In this week's featured interview, we welcome CEO of UV Angel Tom Byrne, as well as UV Angel's Chief Science and Medical Officer, Dr. Linda Lee, for a discussion about UVC technology and how it can be used in dental and medical settings to reduce the risks from both airborne and surface pathogens. One note while recording this interview, Mr. Byrne's video signal was of poor quality, but his audio was fine, so he's represented with his headshot while he's speaking in this video. And now we bring you the interview. Today we're joined by Tom Byrne, CEO of UV Angel, and Dr. Linda Lee, who's Chief Science and Medical Officer with UV Angel. They're a company that is bringing UV technology to the dental industry and has been in the medical industry and other industries. So welcome to our broadcast today.
Thank you.
Thank you.
And I guess to get started, can you tell us a little bit about UV Angel and how the company got started, and what is your focus today as the country is facing quite a challenge with the COVID-19 pandemic?
Sure, absolutely, and thank you again for for having us on. Just in its general format, UV Angel designs and builds pathogen control technologies to obviously reduce virus, bacteria, and fungus on surfaces and in the air. And that emphasis of building those types of products and systems is we want to reduce those levels of harmful pathogens and then limit that risk of exposure to our families, our employees, our customers. So our mission is really delivering those healthier environments. And we got into this space a number of years ago, and quite frankly, our focus has always been on the healthcare side as a foundation. We've expanded into a number of different markets. Obviously, we're here talking to you today about the dental space, but we have focused on the healthcare side because that mission of protecting healthcare workers, of protecting patients, and reducing those risks in the healthcare environment is something that we all hear about day in and day out. So that has been a very strong mission of ours for many, many years. The CDC talks quite a bit about hospital-associated infections, and you could look at that as a pandemic all in itself. But we have really been focused within that area, and thus, as the current environment we live in took everyone, obviously it's been an incredibly difficult time. But our team has really been focused around that healthcare side of creating these environments. So we've really stayed on task, Noah, for lack of a better term. We've stayed on task to continue to create these environments with our technologies that help people. So Dr. Lee, can maybe add a little bit to that from the clinical side, but that's an introduction on UV Angel.
Mm-hmm. Well, and to talk a little bit about the UVC technology itself, how does this light work to neutralize bacteria and viruses and other harmful pathogens?
Great question. Dr. Lee, would you like to take that one?
Yeah, I'd be glad to, Tom. It's a good question, Noah, because so many people ask, especially during this pandemic, well, what can I do? What can I do to return people to work, as we discussed, to return people to school? And UVC is an interesting technology because it doesn't introduce any chemicals into the environment. It doesn't introduce any hazardous materials into the environment. Now, in our technologies, our engineered controlled systems, is that we're looking at treating either surfaces or the air with high intensity UVC and the surfaces with low intensity UVC. And the way it works is that UVC's long been established. I like to think about it as the science history is forgotten. And the reason that I do that is that it's been around forever. Even before antibiotics, they used it to treat many conditions. But interestingly enough, the way it works is it actually interrupts the DNA or the RNA of the virus, bacteria, or fungus. And what that causes is the inability for the bacteria, virus, or fungus to reproduce. And so eventually they die. And what happens is that with UVC technology, it's either on or it's off. If it's on, it's treating the air, it's treating the surface, it's working. But if it's off, it's not creating any residual. So if you think about, there was a interesting discussion today on all of the treatment of schools and environments with adding so many chemicals to them. What is that ultimately going to do to the occupant of the health of the occupant? It's in this space all the time. So UVC works by interrupting the DNA and the RNA. And so far, at least, even when it reproduces or can fix itself, so to speak, there haven't been any resistant organisms necessarily seen in the literature from using this technology. So unlike bacteria, viruses, and fungus that are resistant to chemicals, and chemicals meaning pharmaceuticals or, quite frankly, chemicals to treat surfaces, we're not seeing that in UVC technologies.
Mm-hmm. Now, I know in dental settings, which is most of my focus, they've been really looking for lots of different ways to solve the challenges they face in different areas of their practice. And it seems that many practices I've spoken with are taking a hybrid approach with using, possibly high volume evacuation in the operatories and other things. Is UVC a technology that can work in conjunction with other approaches as you're looking to eliminate the spread of infectious diseases within a healthcare setting?
Absolutely. And that's actually the best way to use them, is that infection prevention or infection control is multifaceted or multimodal. So you've got technologies that are going to remove dirt and grime and debris and materials, and then you're going to sanitize, disinfect, whatever terminology you want to use, to then further treat that surface. So when we treat the surface with that, we're giving a higher level of treatment. So you may use evacuation lines, as you indicated, to get large droplets, large particulate. But in the case of like our air product, which works in the background, works 24/7, as these smaller particles fractionate and become more airborne and stay airborne longer, you may be able to capture those or treat those better than using, say, a vacuum line or a suction line or a system where you're capturing the larger particles generated by the aerosolization of the procedure.
Mm-hmm. Now, with a lot of the, kind of traditional, more chemical approaches that dental practices have taken, especially when it comes to surface disinfection, they're spraying something and there's a set time that they're waiting before they're given, this is certified to kill within X number of minutes. Does UVC need a specific amount of time to work in that same way, or does it function differently?
It actually depends on the application, but that's a really good observation. So all chemicals have a residual or where they have to have a contact time, and then in many of them you don't dry them; they dry themselves, and then that creates a residual. And with UVC, you don't have that. But what you do have is you have intensity, so joules per square meter, against the microorganism. And so all microorganisms have a level of intensity related to the organism. And so in the UV Angel product, which is 100% shielded in the air product, we use high intensity. So most of the organisms we're looking at, all the organisms we're looking at, are treated very well with high intensity UVC in very short periods of time. And so the idea is that you match the intensity of the UVC to the pathogens you're trying to treat. Now, in our particular case, because we use high intensity UVC and because we're actually drawing the air into our chamber and then sending it back out, we can use that in a sealed system but it's bringing that air in about 85,000 times in a 24-hour period. So if you've got a little particle that's floating around, whether it's a coronavirus or a bacteria, it's got 85,000 chances to get through this unit as it's over the patient in that operatory or in that treatment area that the dentist has. So the idea is that running this continuous treatment, which also again makes it very different than chemicals, which you apply, you dry, and then the residual, you apply, you dry, and residual, and it's done over and over and over and over again. This just runs in the background, so it's not interruptive to the workflow of the practitioner. And the other thing is that it's important to understand, even with chemical treatments, is that some chemicals are used as a detergent or a surfactant, and those are cleaners. And then there are sanitizers. So that may be a chemical like, like a sodium hypochlorite, or what might be a brand like Clorox, and they work together. And so you're using lots of product to achieve this sort of disinfection level you're trying to achieve. So it's important that people, especially listening to this video, understand that all these different products do different things. And the user, the end user, the doctor, the dentist, the hygienist, understand the role of each of those products.
Mm-hmm. Is there any real training needed to put a UV system in place, or is it really about where and how you set it up and then just turning it on and letting it do what it does?
In our UV technology, there is no training. It's installed by a licensed electrician. It's put in the ceiling in the case of the air unit. It gets turned on just like a normal light. It runs 24/7, and it just operates in the background. Our Adapt series or our surface technologies are the same. The unit is set up for the practitioner. It goes on whatever surface they're using the application with, and then it comes on when no one is operating the keyboard or the work surface, and then it runs its cycle and then it turns off. So our particular, now UVC in general, is a big category, and there's lots of UVC. And some UVC, quite frankly, you can't be in the room when it operates. Some UVC can be quite dangerous to use in a situation where you're just like, say it's a high intensity robot or tower unit, you're rolling it into the room, everyone leaves the room, it runs a treatment cycle, and then you remove it. We call that episodic treatment. Ours is continuous treatment. So again, there are different applications, but in the case of the UV Angel product, they don't require any training. They run by themselves. They're an engineering control. They run in the background.
Mm-hmm. And Noah, I would add, and Dr. Lee said it there at the end, but we use that term engineering control, and it's kind of a term we use quite a bit. But just to put a little color to that. We feel very strongly that that process of manual cleaning, the process of hand washing, there are a number of things that really need to continue, right? It's you mentioned it earlier, Noah. It really is stacking these levels of things together. And we've watched the news and we've watched YouTube and we've heard about some things that Dr. Lee and myself kind of scratch our heads sometimes, wondering, boy, that just doesn't make a whole lot of sense to be using UV that way. So we really do take an engineered system approach to our products. And, the team under Dr. Lee and the team under our engineers, look at these systems as something that we want people not to have to interface. Remember to turn it on, remember to turn it off, remember to wipe it down, right? Periodic cleaning. We want these items to be engineered to operate so people don't have to think about doing it, that it is actually happening in the background. And I just kind of want to emphasize that, because that really does take years of research and years of a team developing these kind of engineered controls. So it's easy to say, But we really do feel that is an important aspect to attacking this problem.
Mm-hmm.
Yeah, that's a really good point, Tom. And I think that, Noah, from our perspective, it takes less of the staff time to use our technology. Because if you think about every time somebody has to engage in a technology where they have to do it, we call that an administrative control, cleaning surfaces, things like that. It then takes time. And so our technology, because of the way it's designed, doesn't require you to train your staff, and they don't have to interface with that. So it doesn't take time for them to turn it on, turn it off, do things. So that's a really important point that Tom made that I might not have expressed.
Mm-hmm. And it sounds to me like UV Angel has engineered things, to be somewhat in the background, which I imagine mitigates possible risks. But does UVC on its own present risks to people who might be exposed to the light directly?
UVC, if you're exposed directly to the light, can cause issues with skin and eye irritation. Depending on the intensity of the UVC and the exposure, because it's time and dose, just like it is with pathogens. So if you're exposed to high intensity UVC, you could experience eye irritation, some eye damage, maybe some skin sunburn type of effects. And so all people who use UVC. So if you're using a wand and you see some of these portable wands that people use, if you expose yourself to those things, you could have an effect from that. Our units, again, are designed with a lot of safety features, but our air unit, which is high intensity UVC, is 100% shielded. And that's sort of the differentiator for our technology of being able to be used by the practitioner with patients in a chair, with staff working underneath it, because it doesn't have any exposure to the UVC directly. But direct UVC exposure can have some deleterious effects.
Mm-hmm. In terms of the company putting some focus towards the dental industry, Tom, can you tell me a little bit about, you had a background in the healthcare settings. What made you feel that dental settings were also a good fit for this technology?
Well, I think obviously, and I'll let Dr. Lee finish off with that because you're asking a lot of very, very good, pertinent clinical questions, but just the general application of the way the process works to treat those patients that are obviously coming into those environments, and then if you look at the staff, our dental hygienists and really everyone within that environment, there are greater risks when you are doing the normal practices, of course, that are done within that environment. And I even believe some of the OSHA standards kind of talk to that effect, and Dr. Lee could even talk more to that specifically, that show that is a higher risk environment, right? That moves more potential bacteria and virus into the air, and thus obviously we may be breathing that, or if it settles back down to a surface, we're obviously potentially touching that and then possibly inducing that then into our system. So just the way the practices work is for us how we saw that as a market, that again we could help put these preventative measures in place and thus create a healthier environment for those employees and patients and staff. And again, that really is our emphasis, creating these environments that people feel safer and healthier in, is just really the foundation of the organization. But Dr. Lee, did you want to, touch on any of the more clinical specifics to that?
Yeah, as Tom said, OSHA has obviously categories of risk, and aerosol generating procedures, which dental practices have, is a high risk for the patients, high risk for transmission to the practitioner and the hygienist. It's just high risk. And so people, especially dental practitioners, are trying to get reconnected with their patients, because after months of avoiding dental care, they're trying to get people who are at greater risk. You mentioned, people who are immunocompromised or immunosuppressed, still need dental care. And right now, a lot of people are only seeing emergencies, but at some point, people who are in those categories need care for their teeth. People who have cardiac issues need to have their teeth cleaned. We know that dental care is critical to health, especially health of people who have underlying comorbidities. So how do you then get people safely back into a dental practice? How do you get the dentists and the hygienists wanting to see patients, because obviously that's the source of transmission? And then how do you get, quite frankly, people to feel comfortable to come in? So by adding these modalities of protections, whether it's taking temperatures when people walk in, filling out a questionnaire to try to determine their risk for COVID or for having a coronavirus, and then continually treating from an environmental standpoint or reducing the amount of biological loading in the environment, that's where our technologies advance that for the practitioner and, quite frankly, for their patients. And so people need to feel as comfortable as possible that the dentist is doing everything they can within, reason to get people safely in there, to be seen, and then to get their care that's desperately needed.
Mm-hmm.
And Noah, I would
go ahead, Tom.
And Noah, I would add, I think part of your question was, how we were presenting our products to the dental market. I guess maybe in full disclosure, the dental market really chased us, for lack of a better term. We in a roadmap of how our products as an organization would be launched per se in different markets. Dental was definitely on the roadmap, but quite frankly, it leapfrogged a multitude of other markets through, of course, these practitioners just looking for solid solutions that had the science behind them to do exactly what Dr. Lee just described. So I'd like to tell you that we're some magical marketing machine, but unfortunately, we're definitely more of a science-driven, technology-driven organization than we are a marketing machine. We're still working on, all of those other aspects. So fortunately, a lot of that community reached out, and we were able to, really put an emphasis or a focus on that side of the business. And again, it's important to have those patients be safer in these environments.
Mm-hmm. And Dr. Lee, you touched on something that I know is a big thing for a lot of dental practices, which is they're making a lot of investments in making sure their staff and their patients are kept as safe as possible. And they're trying to tell people, these are the things we're doing for you right now. I went to my dental practice actually a couple weeks ago for my regular checkup, and they showed me off, here's a couple of changes we've made. And while they know I work in the industry, so I might have gotten a bit of an insider tour, is there a good way for clinicians to kind of explain what they're doing if they've adopted UVC technology in their practice that would kind of be a simple message to explain it to patients?
Well, that's actually a great question, and I'll touch on this, but Tom is sort of the expert in this. We actually have a marketing campaign called Look Up, and several of the dental practices that have invested in our technology have used that marketing campaign on their own. And so it really is to educate people as to all of the great things the dentist is doing to try to bring as big a level of safety as possible. And nothing's 100% if you walk outside your house, and we all know that. But if you can go in, get your treatment, see the things that the dentist is doing, because they're very visual. and they can see, hey, you know, my dentist is really trying, then people are going to feel safer going back. It's like going to the grocery store. I feel safer going to a grocery store. Of course, I'm in Texas, where people have a mask on, than they not, because I get visual cues to people being considerate and trying to do the right thing. The dentist's office is the same way. And Tom, you may want to talk to him about our program around that, our marketing program around that.
Sure. Well, you actually did an incredibly good job. So you're now being moved out of the scientific department. And we're going to move you to head of marketing. I hope you don't mind. But really, the outcome, as Dr. Lee mentioned, is exactly. So I don't want to repeat what Dr. Lee said, but we've developed kind of a series, for lack of a better term, depending on how deeply the practice would like to go in the marketing campaign. So that combines things like the press release, the lookup campaign, which are tabletop type pieces, pop-up portions. As people enter the practice, they can see and read about what they're doing with the UV Angel technology to create these safer environments. And then it expands all the way to live interviews, you know, on the news, and then moving all the way then to social media aspects that are also then sent out to their patients within their practices, that we do kind of a joint level description of what the technology means to the patient. And so there's a few levels within there that our marketing team has worked very closely with our PR firm to help these practitioners really get the message out the right way. Again, not my expertise, so I'm very, very glad to have those kind of experts on the team in both directions. So,
well, we only have a couple more minutes left here, but I would love to hear your thoughts on what the future looks like for UVC technology and UV Angel.
Yeah, absolutely. And I'm going to let Dr. Lee take the clinical and, you know, that approach, because obviously that's what we're doing, and I'll finish it off for you, Noah.
Wonderful.
Yeah, I think, Noah, the important thing is that as a public health practitioner myself, I very much don't like introducing more and more chemicals into the environment, because the concept of better living through chemistry is good and great, except that we've seen a lot of resistance by microorganisms. We've seen a lot of issues where people necessarily aren't responding well to chemicals in the environment. I'm not suggesting people don't do it. I'm not suggesting at all that they shouldn't clean surfaces and so on. But I, as a practitioner, don't like adding chemicals. I'd like to think of ways that we might be able to get through this now and certainly in the future safely. So I very much think we're at the beginning of this. I think it's going to go on for a long period of time. If we look at history and we look at pandemics, they can ebb and flow over the course of 2 years. And so as we struggle through this and we struggle to get things back on track and kids back in school and people back to their doctors and dentists, I think it's important that everyone look at ways that we can coexist and be safe and get everybody to the other side.
Yeah, and Noah, I would just say, as your question about where UVC goes in UV Angel, I believe just in the UVC space that obviously you're going to see continued expansion, because, you know, for us, our almost singular focus is to make the world a healthier and safer place. I mean, that is the foundation of our organization. And, you know, we do that by our applying the UVC technology and a platform to neutralize, right, these pathogens in the air and on our surfaces. But we take the approach, and I think this is very important to understand, that we apply years of advanced scientific research. And then we take, you know, what I might be a little biased here, but an experienced and quite frankly, world-class team of experts to develop these life-changing technologies that make these environments safer. So we take a foundation of science and engineering, we take a team of experts, we apply the UVC technology, then we do exhaustive laboratory testing, and then of course, as you see, we then also do the in-use clinical validation, and then we put those products out to market. So it's an exhaustive effort to create this or to accomplish this mission. But I would like to believe that as we lead these markets as an organization, I consider us a world-class leader in this space. Others will follow that same approach.
We'd like to once again thank our guests, UV Angel CEO Tom Byrne and Chief Science and Medical Officer Dr. Linda Lee, for joining us on today's broadcast.